How you doing, Professor? I'm here with my parents.
Hi, Professor.
Hello, Professor.
So, how many of you have been bullied? I know I have. I was bullied off and on from middle school through high school, and according to the CDC, the Center of Disease Control and Prevention, 1 in 5 high school students reported being bullied just last year. Bullying is an ever-growing and ever-changing problem. From the physical trauma to the emotional damage, there are multiple negative psychological impacts for victims to endure. The severity of the bullying epidemic is appalling. While there have been more strides to curb the bullying over the years, there's still more for us to do in terms of prevention. Today I'm going to discuss the negative effects of bullying, how we can prevent it, and what we can do to help the victims. First, I'd like to discuss the short-term and long-term effects of bullying. Bullying can surely impact the lives of victims, but it can also impact the bully too. These negative effects of bullying victims can vary, and according to licensed social worker Katie Hurley, in an article for SciComm, all kids are different and are likely to exhibit varying behaviors during or after the bullying period. There is a long list of short-term effects of bullying these victims face, such as social isolation, symptoms of anxiety and depression, school avoidance, feelings of shame, and even poor social performance. These feelings of shame can stem from both individual bullying or social bullying, and as described by the CDC, includes the acts of excluding someone, spreading rumors, and making embarrassing comments. Depending on the severity of the bullying, the victims tend to feel ashamed and embarrassed to the point where they lose a lot of self-esteem and feel helpless. Long-term effects of bullying for victims can be an extension of short-term effects that continue or can develop at a later date. These effects are well documented, and as Dr. Callie Zani-Papalasi stated in an article for The Conservation, research has shown that victims of bullying report more severe anxiety symptoms than others. Being bullied is also linked to social anxiety and often lasts into adulthood and increases the risk of developing personality disorders. For most people, the long-term effects are ongoing, such as anxiety, depression, and PTSD. There are also much tougher issues that can manifest, like establishing friendships, self-harm, suicidal thoughts or attempts. And according to the Suicide Prevention Resource Center, bullying is associated with increases in suicide risk in young people who are victims of bullying, as well as increases in depression. Not only are there negative effects for the victims of the bullies, but the bullies themselves have short-term and long-term effects. Hurley states, while it can be difficult to empathize with the bully, it's essential that parents and school officials recognize the bullies engage in bullying behavior for a reason. There are plenty of bullies that receive some sort of punishment, such as expulsion or legal action. Whether or not there was discipline involved, there are other negative effects, like poor school performance, difficulty maintaining social relationships, and antisocial behavior. And now that I've talked about the negative effects, let's talk about ways we can prevent it. There are multiple methods to help stop bullying and inform people how to deal with it, whether through discipline at school, students being educated on how to stand up to bullies, and parents just teaching kids to respect one another. StopBullying.gov says parents, school staff, and other caring adults have a role to play in preventing bullying. Parents and other adults need to encourage kids to speak up, whether to a teacher or a principal, about being bullied or witnessing someone else being bullied. There should be guidance and instruction on how to solve issues with the bully, whether by the student themselves or if adults have to intervene. The next step with bullying prevention is keeping an open line of communication between the parent and child. A third way to prevent bullying is actually something simple but the most impactful: teaching children to treat others with respect and kindness. Now that I've discussed some of the ways to prevent bullying, I'd like to talk about the ways we can help the victims. Advocacy for victims of bullying is as important, if not more important, than any discipline the bully can receive for their actions. It's extremely important that any victim of bullying is met with open arms and open ears to help them get through the trauma. According to a piece by Dr. Mary Stevens for the American Academy of Family Physicians, helping patients to disclose their experiences to their parents, if appropriate, is the first step in building a supportive network of empathy around the patient. Therapy is one of the most integral aspects in helping victims overcome the negative impacts they've experienced. Taking action against the bully may seem as the best way to help a victim, and as necessary as it is, the victim needs to find a network of supporters, such as therapists or even fellow victims. Disciplining the bully can help stop the initial abuse, depending on the severity of the punishment, such as suspension, but it's entirely possible that it could persist. There still needs to be something the victims can do to become more empowered. According to StopBullying.gov, National Bullying Prevention Awareness Month is a great time to mobilize your community to develop a plan to prevent and address bullying. Every single aspect of bullying can have short-term and long-term negative impacts on the lives of both victims and bullies alike. While there are actions that can be taken after the onset of bullying, teaching kindness and morals, along with taking preemptive measures to create an atmosphere of security and safety, is the most impactful way to prevent bullying before it starts. If bullying does occur, the victim needs to be heard and helped by creating a sense of safety and openness. The bully needs to be disciplined, but still given the same psychological help that the victims receive, and hopefully give confidence back to the victim and correct the behavior of the bully. Thank you.